Good day, everyone. You're welcome once again to my YouTube channel. And today I'll be talking about another form of mental disorder called PTSD, which is post traumatic stress disorder. A lot of us experience PTSD in either small or large ways without knowing what we're actually experiencing. So today I'll be talking about what PTSD is, what causes PTSD, and how we can treat PTSD. PTSD can happen to a person after experiencing a traumatic event that has made them to feel fear or shock or helplessness. It can have long-term effects such as flashbacks, insomnia, or excessive anxiety. Some examples of some events that can trigger PTSD include wars, crimes, fires, accidents, death of a loved one, or abuse of some form. Someone experiencing PTSD after going through a traumatic event, instead of feeling better, this individual may become more anxious or fearful that that experience might occur again, and can also have dreams about it or nightmares or even daymares, and it can disrupt a person's life for years. But there's treatment that can help anyone suffering from PTSD to successfully recover. Now, how do you know that you have or you're experiencing PTSD? There are four types of symptoms. There's the intrusion symptom, which include having nightmares, flashbacks, and a sensation that the event is going to happen again, or fearful thoughts about that traumatic event. There's also avoidance symptoms, that is, refusing to talk about that event or avoiding situations that remind you of that event. There's also the arousal and reactivity symptoms, which include difficulty sleeping, being highly irritable or having angry outbursts, being highly or hypersensitive to possible dangers, or feeling tense and anxious. And there are also symptoms that affect mood and thinking. You can, maybe if you are experiencing difficulty concentrating or having a reduced interest in life, as having suicidal thoughts, or feeling, if you're having feelings of guilt and blame, or beginning to have the inability to remember some aspects of that event, or feeling detached and estranged from others and emotionally and mentally numbed, then you might be experiencing PTSD. Also, some physical symptoms of PTSD, and they include excessive sweating, shaking, headaches, dizziness, stomach problems, aches and pains, and chest pain. Can also have sleep disturbances, as I've previously mentioned, which will result in tiredness and which will lead to anxiety. As opposed to common opinion, it is not only adults that can experience PTSD. Children and teenagers can also experience PTSD. In children aged 6 years or under, some symptoms of PTSD may include bedwetting after learning to use the bathroom, inability to speak, acting out the events in play, or being clingy with an adult. For children of ages older than that, between the age of 5 to 12, they might not have flashbacks and they may have difficulty remembering parts of the events. They may also have nightmares and be highly irritable. Because some parents don't understand what these symptoms are or know of these symptoms, they might just dismiss it as their children having tantrums or being difficult, when it is actually when it is actually them having PTSD. Between the ages of 12 and 18 years, a person having PTSD may show disruptive or disrespectful, impulsive or aggressive behavior. They might also feel guilt about not being able to change the action or the cause of that event, and they may consider revenge. Some common causes of PTSD include military confrontation, natural disasters, serious accidents, terrorist attacks, loss of a loved one, rape or other types of abuse, personal assaults, being a victim of crime, or receiving a life threatening diagnosis. In in summary, any situation that triggers fear, shock, horror, or helplessness can lead to PTSD. So, if you pass through any situation in your life that might trigger all these things, then you are in danger of experiencing post traumatic stress disorder if you don't get therapy to treat the memories or effects of those traumatic events in your life. How do you know when you should see a doctor for PTSD? Many people experience some symptoms after a traumatic event, such as crying, anxiety, and difficulty concentrating, but this is not always PTSD. Treatment with a doctor should be considered if the symptoms persist for more than a month, if the symptoms are severe enough to prevent you from returning to your normal life, or if you consider harming yourself. Treatment for PTSD usually involves psychotherapy, counseling, medication, or a combination of all three. Apart from getting help from a doctor, there are some self help tips that can help you cope if you are experiencing PTSD. And this include learning about PTSD and understanding that an ongoing response to a traumatic event is very normal and that recovery takes time. Healing doesn't happen overnight, it takes time, longer time for some people and shorter time for others. And accepting that healing does not necessarily mean forgetting. You might remember that event, but you can also move on from it even though you have not forgotten it. That means you that means gradually feeling less bothered by the symptoms and having confidence in the ability to cope with these bad memories. And some other things that can help include finding someone to confide in, either a family member or a friend, spending time with other people who know what has happened to you, letting those around you know what might trigger your symptoms so they avoid doing those things. Listening to quiet music or spending time in nature, doing some physical exercises such as yoga. Treating PTSD is very similar to treating an anxiety. PTSD can lead to some complications which include difficulty with work or relationships. For example, people that have experienced an event such as rape might have difficulty surviving in a relationship. So if they don't get help for that, they will not be able to function properly with other people or with their partners. And it also leads to a higher risk of heart problems, a greater chance of having a chronic disease, and having other health problems such as depression, anxiety, personality disorder, or leads to the misuse of substances such as alcohol or drugs. So if you notice that after a traumatic event that might have occurred in your childhood, teenagehood, or even now, or might occur later on, you have you experience all these symptoms, good. You should use all these self-help tips, and if the symptoms do not go away for like after a month, then you should endeavor to see a doctor. Thank you for being here today, and I hope you all learned a lot from today's video. See you next time. And please don't forget to like and subscribe to this channel.